Welcome to this edition of AFMC.
I'll tell you how I got better. I'm
Glad to be here.
But a mission to
Delivery of
improve.
I think that we're going to talk about everybody's.
Arkansas is the second highest prescriber.
Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Dr. Gwen White. She's a pediatrician and the vice president of the Arkansas chapter of the American Academy of Pediatrics. Dr. White, thanks so much for being here.
Thank you for having me.
So we've been hearing a lot, or more and more, from Arkansas parents that are voicing concerns about childhood vaccines. From where you sit, what's changed in the past year or so?
You know, honestly, I think that there are a couple of things that have changed. Over the last, I'd say probably 5 years since COVID, we started just seeing a significant distrust in the healthcare system as a whole. And that's definitely worsened over the last year. But on top of that, I think that we're seeing a very big difference in where people actually get their information. And so it used to be that when it comes to people that have concerns. It was because, a grandparent said something or they heard that, so-and-so, this happened to so-and-so, and so they were curious. But now it's a video or a meme that they saw or something on social media that's where people are getting their primary information. And there's a lot more, not only misinformation, so that unintentional kind of outdated information that's there, but also a lot of disinformation where, organizations and groups are really being intentionally deceptive and putting information out there that is just not true, but it's, not content that really sticks. And so it's becoming more difficult. So those conversations that used to be pretty straightforward now take a significant longer period of time to have.
And are there certain vaccines or maybe even certain age groups where you're hearing the most hesitation or questions right now here in Arkansas?
So I think it's honestly across the board. So historically in Arkansas, HPV vaccines have been a lower rate of uptake. Flu shots have been a lower rate of uptake compared to the rest of the country. But now it's vaccines across the board, all ages, all groups. People are really kind of questioning a lot more things.
Have we seen any actual changes in vaccination rates here in the state since all this national talk about the Immunization Advisory Committee?
So we know that the vaccine rates went down during COVID, and that was not only in Arkansas, but across the country. I don't have any of the specific data that looks at Arkansas specifically right now. What I can say is that dealing, on a day-to-day basis, dealing with families and talking to my peers and counterparts that are pediatricians across the board, we are all seeing a large uptick in people that are refusing vaccines. And I feel very confident that data will be reflected down the road.
And should families or providers be expecting any new vaccination recommendations or schedule updates in their future?
So the American Academy of Pediatrics just put out its 2025 immunization recommendation schedule. And so that's going to be the most up-to-date information. And I don't anticipate anything major coming out again until next year.
And we know some parents are skeptical or just confused about certain vaccines. What advice do you have for healthcare providers on giving some conversations that help build trust?
So that's a very good question because, it's a hard situation to be in. I think that number one, it's important to make sure that you are using empathy. Empathy is what's going to build those bridges out to evidence. Recognize that trust is built over time. It's not just one single conversation. It's going to take time. And so as healthcare providers, I think that it's important for us to, number one, not get frustrated. Try to meet people where they are. Ask them questions like, what have you heard? What's worrying you? What are you most concerned about? And try to meet them there and build that information and build up that relationship from there. The American Academy of Pediatrics has a lot of guidance online on specific things that you can say, words to use. They really focus on trying to explain, how immune systems are designed to learn and how the recommended vaccine schedules are designed to help to induce immunity. They talk about discussing the benefits of healthy child development that occur with getting your routine immunizations. discussing how, as a healthcare professional, your goal, your top priority, your role is to keep kids healthy, and bridge the conversation from there. And then really discuss how important it is to have widely available, easily accessible, and important and affordable vaccinations just across the board to help keep our communities safe as a whole. And so, when parents and when families are vaccine hesitant, honestly, most of them end up at some point still vaccinating. They're just scared and overwhelmed. And so just making sure that we are meeting people where they are and trying to build those relationships is crucial.
So if you're a parent right now, what's the one thing you should be double checking when it comes to your child's vaccination schedule?
I think that just making sure that you look at the 2025 AAP immunization schedule and making sure that your kids have those. It's pretty straightforward and it's out there, easily accessible.
Are there any new or updated recommendations for the school year or flu or COVID shots that families should have on their radar?
So the AAP continues to recommend flu vaccines and COVID vaccines for infants 6 months of age and older. And so we recommend all children have that.
And if a family member has fallen behind or delayed some vaccines, what's the best first step to get caught up?
The best first step is going to your pediatrician and talking with them. They can get you up to date. These vaccines have been tested in tandem, and so they'll be able to let you know what vaccines you can get and when, and the schedule to get on.
And when you look at the next few years for our state, what do you see as the biggest challenge and maybe the biggest opportunity for improving vaccination rates here in Arkansas?
I think that the biggest challenge right now is that misinformation and disinformation. And I think that honestly, that creates the biggest opportunity. We have to think about vaccines in a way that we haven't thought about them before. Historically, we can just put out the guidance and, utilize the internet and flyers, and that was sufficient. But now we have to meet people where they are. So we have to have more physicians that are on social media, more physicians that are on TikTok and Instagram and Facebook and doing whatever to get the information where people are. We have to meet people where they are, and we have to be consistent with that, giving a consistent and reliable message.
Are there any outreach programs or education efforts in our state that you think are really moving that needle?
So Immunize Arkansas has been an organization that's been around for a very long time, and they have been working really hard long before all of this started to get the vaccination rates improved. They have lost a lot of funding, unfortunately, but their purpose and their programming is fantastic. The health department has the Vaccines for Children's program, which is the federal program that provides for vaccines for children that are on Medicaid or that are underinsured. And so they have a lot of outreach programs that help to alleviate barriers, basically. And then the Arkansas chapter of the American Academy of Pediatrics. There are several grants that we have had over the last couple of years, where we've gone into clinics and worked with providers individually to teach how to talk about vaccines. How do we discuss in a way that families can receive them, and kind of give some one-on-one information at clinics throughout the state. And so all these organizations have worked together individually and collectively to try to help push the needle. And
you touched on this briefly. This is not really one specific type of vaccine. This is hesitancy you're seeing across the board for all vaccines.
Yes. Yeah, starting as early as the newborn. So when babies are first born, there's a recommendation that they get the hepatitis B vaccine. That's the first vaccine that babies should receive. And from day one, we're seeing more and more where parents are saying, no, I don't want that, or I want to delay that. And that conversation continues on through their 2, 4, 6 months, et cetera. So it's across the board.
And there has been in neighboring states some measles cases, but that has died down. Are you seeing that affect our state still?
So we have had cases of measles in Arkansas. We have not had any in the last month that I'm aware of, but I definitely think it's still a concern. Measles is such a contagious virus, and as we are seeing more and more people that are unimmunized, the numbers are going to continue to increase. And so even though it's not an acute thing today, literally it just takes one case to run rampant across the board, and we'll be in trouble.
And finally, for healthcare professionals that are watching today, what's the one takeaway you hope they remember from this type of conversation?
I think that it's so important to remember that children's healthcare is not political, and that vaccines save lives. Science is very clear on that topic, and so it's so important that we just stand on the settled science of vaccines, just stand together.
Well, Dr. White, thank you so much for sharing this important information and for all you do for the healthy kids in Arkansas.
Thank you for the opportunity to share.
And that's it for this episode of AFMC TV. Have a great day, and thanks for watching.